So there's a word that I have pretty much removed from my vocabulary as a clinician, and that word is compensation. And it's not because I don't think that people don't change the way they move when certain things are going on. They will. But I stopped using it because I was realizing that the word was creating more confusion to a patient than clarity. And it was starting to add almost like a pathological subtext to what was going on. And when I would talk about, when I used to use the word compensation, I would also notice that it was changing how people were experiencing their movement. So let's explore the word compensation because it's overused in musculoskeletal rehabilitation settings. And what do people even mean when they are saying it? So let's start with, what happens when someone starts to develop pain. Maybe they're having shoulder pain or knee pain or some low back pain. And you start watching the person move and you say to them, hey man, you're compensating. And sometimes you might even get more specific about it when you phrase something like that. You may say, hey, your body is compensating because X muscle isn't firing right now. Or this one, which I'll hear in therapy situations, but I hear it more in coaching situations. Hey, if you're gonna keep moving like that, you're just gonna get injured. And then this one is the one that it may not be exactly like this, but when people say it, but it's kind of what they mean. And if I had to summarize all the times I've heard it into one sentence, it's something along the lines of, we need to fix this compensation before you can return to lifting safely. And unfortunately, these statements are becoming more common. And the problem is, again, what do people mean when they say these things to a patient or a client? So if I was out there asking 100 clinicians to define what they mean by compensation when they use that word with a patient, you're probably going to get some pretty vague answers. You may hear things like, well, it's an alteration in movement when there isn't a normal strategy available. Okay. But again, what does a normal strategy mean? Who is it normal for? Is this a strategy that's normal in Olympic weightlifting, or for my grandma, someone who is, throwing a baseball? A normal strategy for somebody with scoliosis? There isn't one movement solution for every problem in biology. There's many solutions. So what do we mean by a normal strategy? And how do we know we're deviating from it? These are difficult things to define. And your nervous system isn't always out there trying to create the most perfect movement for something. Your nervous system is just trying to solve the problem in front of it, given the constraints that it has today. So if there's constraints around pain with some sort of movement, if there's constraints around levels of strength or motion, maybe somebody has a real stiff knee that isn't bending all the way today. Maybe the person just lacks the skill. They're short on the skill for what you're asking them to do. They're afraid of trying it. They're a little tired today. They don't have any experience with it. And you'll see that a lot in coaching and rehab, telling somebody to do something they've really never done before and then telling them they're compensating. So you always have to think, what's the best solution available to that person right now? And that is the question, that question right there, what's the best solution available right now? That's the question that the person's nervous system is constantly asking itself when the body's trying to perform a task that's set out in front of it. And using these lines of thinking, it's kind of where rehabilitation often will go wrong in the use of this language. You see an alternate movement strategy to what you're used to, let's say, or what you've been told is a normal movement strategy for a problem that the patient's trying to solve. So you see them using an alternate movement strategy. And instead of standing back and asking, okay, why is this person choosing this solution right now to the thing I asked them to do? Many times it immediately gets labeled as some sort of compensation. Oh, they're compensating. And once that label gets thrown on there of compensation, now there's another leap that's made, and it's this compensation that this person is making to this movement strategy that I've presented to them is the reason that they're hurting, because they're compensating. So now they're getting hurt. And think about what that's going to sound like to the patient if you tell them you're getting hurt because of this compensation. They're going to think, oh, okay, somehow there's some maybe muscle shut off that I wasn't aware of, especially if the clinician uses the words like, you're compensating because this muscle's not firing. That's not helpful to the patient. Then again, if you tell them, man, if we keep moving like this, we're probably going to get injured. Well, now everything that they do in the gym is going to start to feel dangerous to them. They're going to be like, oh, am I doing it right? Because I don't want to get hurt. And then, that other one that we discussed earlier, if you don't fix this compensation pattern, then you're probably not going to be able to lift safely. Well, now every time they're going to go out there and lift, all they're thinking about is, did I correct this compensation correctly like the therapist told me? And unfortunately, this explanation that you're using around what's going on with them is going to end up being detrimental to the long-term outcome in the treatment strategy, whether you realize it or not. The words that you're choosing to use and how you're explaining your use of those words to the patient have a big effect on how they think outside of your clinic. So remember this sentence, write it down. When we label every alternative movement strategy as a pathological compensation, we don't just change how patients think about their movement, we're changing how they are experiencing their movement. So instead of going out there and being curious about exploring their movement, they're going to start monitoring everything they do. Instead of becoming curious about how to do certain things, they're going to start becoming cautious about every single thing that they're trying to do away from your office, especially in a gym setting. Now they're not learning anymore. They're just looking for mistakes that they're making. And that becomes a very different experience in the rehabilitation setting for the patient. So, don't get me completely wrong here. I'm not going to say that every movement strategy that a person chooses to use is equally efficient to do what we're asking them to do. Some strategies that people choose are going to waste energy over others. Some may place load on certain tissues over others that could be doing the task a little with a little more strength or power. Some of the strategies people will choose to use are going to become more limiting as the demand of the task starts to increase. And this is different from saying that the strategy they have chosen is pathological. So you have to really be careful how you word it. And one of the biggest lessons that I've learned in coaching is that many people I see were never actually really coached. And this is, I'm a coach and a clinician, so I dip my toes in both worlds. And that's one of the things that I have seen in my coaching experience. And when people come to my clinic and they have issues related to sport or training, that's also something I noticed, is that they were never actually coached very well in the thing that's giving them trouble. And I think about it this way, because I've coached a lot of CrossFit gyms and some other kinds of facilities. And sometimes, maybe somebody showed the person, let's use a power clean as an example. Maybe they were shown the power clean one time or maybe a few times. Same thing with like a squat or deadlift. Maybe somebody kind of went over the movement with them in a kind of cursory way and then moved on. And they decided that the person they were coaching has been able to do the task good enough, we'll say. But after they were deemed good enough, unfortunately, nobody was staying with them long enough to continuously refine the movement that they were working on as things like load increased, as things like speed increased, as things like complexity increased. And then months go by and they're in my office or they're in somebody's office, and then they're being told that they're making some sort of compensation. And, maybe that's true, but, with the way we're defining that word, it's not a good choice. But more than likely, they simply just reached the limit of the movement solution that they were using, and they were never coached beyond that good enough position. And these are different explanations for the patient. So this is why I definitely lean into my coaching experience before I do any sort of treating when I'm working with patients. Unless there's some sort of real obvious, significant range of motion issue when we're going through our first day, or some sort of other major physical limitation that we need to spend some time on before we get to do the thing. But more than anything, I'm just interested in seeing what happens to the person if I can simply sit back and give their nervous system some better information to work with. Can I give them a different cue that helps refine their movement for that lift that's been bothering them? Can a different task I give them help them, create more organization in their system so that they can do it more effectively? Will coaching just solve this issue that people are calling compensation? And many times it can. And I don't think rehabilitation should begin by hunting for all these compensations in people. It should begin by understanding the solutions to movement that the person is choosing. And your nervous system isn't trying to fool anyone, it's just trying to solve the problem. And what we shouldn't be doing as clinicians is sitting back and criticizing the solution that the person has chosen. It's our job to understand why that solution emerged when they were trying to accomplish this task. And then we can sit back and help the person learn to discover maybe a better solution that's a little more efficient than the one that they were choosing. And many movement strategies that get labeled as compensations are simply a movement solution that was never coached beyond good enough. And I think that's a much more useful place to begin with a person.